So in high school I got to do a work experience placement and I got to go to the Women's and Children's Hospital. So I absolutely loved that, fell in love with nursing from there and decided that it was a career that I wanted to pursue. I chose nursing at Adelaide because obviously the course, it's brilliant from the placement side, how much placement you actually get to do. I did look at a few other courses, but that was definitely a big attraction to the course.
So our lectures and tutorials cover a lot of the skills and that we use in the clinical setting. So first we'll learn them in the classroom from our lecturers, and then we'll come in to further reinforce them in skills lab. So we'll get shown the proper techniques and everything to use, and we'll get to have a go at them practically. And then when we're in the clinical setting and our nurses that we're working with will be like, oh, can you go and do this for me? And you'll be like, okay, I know how to do a wound dressing, or I know how to do a blood pressure. And so I think the more that you do it with placement, it helps a lot back in the classroom.
So in the skills lab we have small groups, so it's really handy if you've got to learn how to give immunisations and take blood, because in the small groups everybody will get an opportunity to do the skill, learn the skill, work with the lecturer, maybe even one-on-one, and then when you go out to the placement you know how to do it and you feel confident in doing it. You learn off of each other in the small groups, which is really good, and you can go back on placement and chat about it and things like that.
Our clinical lecturers are with us throughout our placement, so you've always got someone to go to if you need help, or they're there to help you with your assignments and everything that you need to get done for your placement.
I had really one good lecturer a while ago. I was struggling with a placement and he came and visited me, and we actually just sat down and spoke for a whole hour about everything I was struggling with, and it's really, really helpful. They're there to support you all the time.
So one thing which I was really concerned about when I came to uni was making new friends. First couple of days I was really shy and a bit comprehensive about it, but everyone's got the sort of same interests, so you all mould together really well. I've made a really close, tight-knit group of friends, which are great. Like, come and chat with them about your placement experiences, but even if you see anyone from a course down the street, you know, you can go up and chat to them. Everyone's really friendly, which is great.
When I was in first year, one of the most exciting things that I got to do was on the cardio ward. I followed my patient down to have a cabbage, which is open heart surgery. He was getting a bypass graft done, and I got to stand in on the procedure right up with the anaesthetist. I was up on a stool, could look over into his chest while they were doing the operation. And yeah, we were in there for 3 hours. It was freezing, but it was great. It was so exciting. Yeah, an amazing thing for first year.